My name is Charlene Doria-Ortiz. I'm the program manager for the Division of Community Health in Bexar County in San Antonio, and it's the Department of Community Investment. Why the bill passage is so important is because we kind of had in San Antonio the privilege of, under the last bill, of being designated the county to handle the first pilot program. And so we were able to conceive and design what we feel is a very good public health, community health program in regards to needle exchange. And yet we weren't able to get it completely off the ground because of the legal implications. But the parts that we were successful in getting done, and the components of the program that we're implementing now, like looking at the need in community for a safe disposal for needles and developing that infrastructure, doing harm reduction and prevention in the area of condom distribution, bilingual, bicultural, low literacy information, working with community partners, gathering baseline data. All of those things need to be done as the first steps in any design of community-based program for needle exchange. So that did not go for naught. What the passage of the legislation will do will allow us to go to the next phase. And Bexar County will be privileged to be a step ahead of everyone else because we've had these last 10, 11 months to think and gather data and to assess and to develop partnerships and to be ready to get out of the gate once the legislation is passed. So we're very hopeful and anxious that it does pass so we can get on with the business at hand of saving lives and doing a good public health campaign.
So what would needle exchange distribution look like? How would this happen and who would pay for it?
That's a difficult question to answer specifically. Number one, in the legislation, probably it would just allow for the design and implementation of programs. It would probably be an unfunded mandate, which means that it would be allowed, but local jurisdictions like your counties or your cities would have to then say, okay, we want to find money and we believe in it and we believe it's good public health, and so we're going to put money into it. And so that's one source. The other one is that there is a federal ban currently on the funding of needle exchange programs. Under the new administration in the White House, starting in 2009, there may be, over the next several months or year, a lifting of that federal ban. Hopefully, along with the lifting of the federal ban, money would also flow. The other part to that is why it's so iffy is our economic circumstances right now, philanthropically, given that we're in a recession, is that how much money is going to be available for needle exchange, which has been very limited. There are only a few foundations that give to needle exchange. But if the legislation passes and it becomes and adopts and programs adopt the broader concept of public health, harm reduction, community health, then our ability to access a variety of funding sources and not solely be limited to needle exchange, but needle exchange will be one part of that. And I think looking for diversified philanthropic funding in the time of a recession is going to be challenging because we're going to be competing with so many already existing very worthy causes.
What has been the reaction of the county commissioners and other stakeholders in San Antonio and Bexar County to the idea of syringe exchange?
Overall, I'm very lucky to work for the county. Overall, the leadership of the county, including the executive director of our Department of Community Investment, Aurora Sanchez, and the county commissioners, including our county judge, just have been very, very supportive of the concept of harm reduction, and I think they were very proud and privileged to want to be designated to run and implement and design the first needle exchange program, and allowing us to do the baseline and giving us the financial support to do the baseline work that we needed to do, doing good needs assessment, gathering statistics, visiting other programs throughout the country, looking at good program models, looking at evaluation, what are going to be the outcomes, looking at a comprehensive program design. They gave us the dollars to be able to do all of that. The only one component that we were not able to do is actually implement needle exchange, because it was ruled that that was not allowed, that the Health and Safety Code had not been changed by this current legislation, and so, which is one of the reasons resulted in why the legislation is being reintroduced, to discard that ambiguity, make it very clear, and say, yes, we can go forth and actually do needle exchange, along with all the other prevention, harm reduction components that we currently have designed and are currently implementing.
Okay, one final thing.
Okay.
What would you say to somebody who had reservations, in particular, that providing syringe exchange is going to help encourage drug abuse?
I would ask them, do they believe in human potential? And then I would see what they would answer. And I always have. I believe that people can change. I believe that becoming a human being is a process, and we all aren't perfect, and at times we fall and do things that aren't morally or legally acceptable. But everyone should be given the opportunity to change and make a better decision. And oftentimes from those very people come the passion and come the insight to helping others. And it's the best example that I can give you is Bill W., who was the founder of Alcoholics Anonymous. Where would we be if that man had not believed in needle exchange? And so anyone who is opposed, I'm saying, look how successful Alcoholics Anonymous has been with an addiction called alcoholism. Why can't we do the same with drug addiction? And needle exchange could be one of those ways of leading people back and believing that people can change their behavior.